I just want to say thank you for making the time to come and learn a little bit more about the CHW codes that we have with the Arizona Healthcare Containment System. And so we all know access. So we have here today with us, we have Ruben Solis and Samantha Williams, who will be providing us an overview of what are those codes, what are they intended for, and how we can utilize them. And we all know that we have been working around the CHW workforce for many, many years and trying to put all the steps together to really look for a way to get to reimbursement for CHW services. And I think that the work that we've done in the past years, the partnership that we did with Access and really identifying the way to build and to get these codes on here for us today, so we can really get them together and use them to get the reimbursement for our CHWs that are working with us, and for our team to continue working in our communities and addressing those needs that we have not been addressing for many, many years, and we know they are so much needed. So today here with us, we have Ruben Solis and Samantha Williams, and I just want to say again before they begin, thank you so much. My name is Floribella Redondo. I'm the co-founder and the CEO of the Arizona Community Health Workers Association. And please, if you can just provide us in the chat your name, your organization, your title, so we know who attended today, and we can follow up with any information with the recording of this session today, so you can continue having the information that Ruben and Samantha are going to be providing. And it's always we're going to be always trying to put this in our platforms and our social media and our website, so you guys can continue to access it and continue looking and listening to all the great information that we're going to be getting to this day. So with that, I don't see Corina here, so we'll pass it to Samantha and Ruben. Thank you, Samantha and Ruben.
Thank you. Ruben, you can go ahead and introduce yourself, and then I'll take over and we'll jump in.
All right, it took me a moment to unmute. Ruben Solis, Federal Relations Chief and Health Policy Advisor here at Access. Samantha is going to be presenting today and has a special insight into the provider enrollment process, and I'll be available for any questions that folks might have about policy and billing for CHW services. Thanks.
All right. So we're just going to go ahead and jump right in. So when we first started with our CHW services, we had a two-phase approach. So our first phase was allowing certain provider types to be reimbursed, provider types that already exist to be reimbursed for their CHW services. So that was our path one, while we were in the process of our phase two, which was creating our CHW organization provider type. So that special provider type that is only the CHW organization and the CHW services that they provide. So in March 2024, we were able to officially launch the CHW organization provider type. Thus far, we do have some applications for CHW organizations, and we have been able to approve a few organizations as well. Next slide. So this goes into our, again, this goes more into the phase two of the CHW organization. And so really the CHW organization is for existing providers who really weren't included in the phase one, right? So if you were a CHW organization who, you weren't part of a hospital, you weren't part of an FQHC, but you're still out there providing these CHW services as an organization and still wanted to be reimbursed for those services provided to Access members. Okay, next slide. I'm so sorry if I'm talking too fast. So we're going to play a video right now that really goes over how to enroll as a CHW organization. And so this is going to go through the APEP enrollment process and go through those steps as far as getting enrolled as the CHW organization access provider. Is the audio gonna play? That's always the magic question. It is not.
Is the audio not working? Let me see if I can.
Or CHWs are frontline public health workers.
Can you hear it
They
now?
have a very close understanding
Yes.
of the community they serve, and they help connect people. Community health workers, or CHWs, are frontline public health workers. They have a very close understanding of the community they serve, and they help connect people to the services they need. These services could include navigating the healthcare system, encouraging preventive care, offering resources for managing chronic illnesses, maintaining healthy lifestyles, and assisting in culturally and linguistically relevant ways. For a long time, various communities and organizations across Arizona have employed CHWs. At least 5 access contracted health plans and at least 19 of the 28 tribes in Arizona have CHWs. Now, these services can be reimbursed for access. To receive reimbursement, community health worker organizations must become access registered providers. It is important to note that Access doesn't register the individual CHW workers and instead enrolls the organization that the CHWs work for. When the CHW organization applies for Access enrollment, the organization will submit and maintain a list of all certified CHWs they work with, whether they are directly employed with the provider or are subcontracted and receiving a 1099. That list can be uploaded into APEP with the provider application. How does a CHW organization register as a provider? Registering as a provider is done in the APEP portal from the Access website, www.achaccess.gov/APEP. If you have never created an APEP account, you will first need to complete the new user registration. If you already have an account in APEP, you can start a new application for your CHW organization. Once you have successfully registered and logged into APEP, click the Provider tab on the top of the page. A drop-down will prompt you to start a new enrollment, track an application, or manage provider information. If you are registering as a new CHW organization, you will select New Enrollment. On the Enrollment Type page, select Atypical Agency under the enrollment type. Once you click Submit, it will take you to the application steps, and you will follow each step, filling out all the required information. Step 4 is where you will select your provider type. Click the blue hyperlink to open the step. Once Step 4 is open, select the Add button. A drop-down box will appear for the provider type. Select Community Health Worker Organization from that drop-down. When you arrive at Step 11, you need to upload the list of CHW employees, like was discussed earlier. Click on the link to Step 11 to open it. You can download the template from here. Follow the directions to enter the required information. When ready, upload the document. Fill out the rest of the application as prompted with the required information. Once the application is complete, there are a few more steps CHW organizations need to take for the enrollment process. CHWs are considered a high-risk provider, so in addition to the application in APEP, the following is required. A fingerprint-based criminal background check, or FCBC, for certain owners and/or controlling interests, a site visit, and an enrollment fee payment. The 2024 enrollment fee is $709. The application process can take 60 to 90 days from the date of the application. Sometimes a new application for your CHW organization may not be needed. If your organization is enrolled as one of these provider types, you can already bill for CHW services without a separate enrollment as a CHW organization. 638 FQHC, BH outpatient clinics, community/rural healthcare centers, DO physician osteopaths, federally qualified health centers, hospitals, integrated clinics, MD physicians, physician's assistants, and registered nurse practitioners. For any registered organization seeking reimbursement for CHW services, they must ensure that any CHW providing services is certified and that they are providing a medically necessary service as recommended by a physician or licensed practitioner. Records of all CHW's certifications must be kept up to date, accurate, and available to access upon request. You may employ CHWs that are not certified, but you will not be able to submit for reimbursement for services provided by the non-certified CHWs. Many Arizona members of Medicaid are enrolled in managed care plans. Enrolled CHW organizations will need to credential and contract with Access Contracted Health Plans to be reimbursed for services provided to members in a managed care organization, or MCO. Once approved as a contracted provider within the health plan's network, you will be working with the billing department for the appropriate billing practices. Any Access registered provider can provide services and be reimbursed for Access fee-for-service members, such as members enrolled in the American Indian Health Program, or AIHP, without being contracted with an MCO. Claims for CHW services may only use the following codes: 98960 for individual patients, 98961 for a group of 2 to 4 patients, and 98962 for a group of 5 to 8 patients. CHWs can bill in 30-minute increments for the services they provide. A maximum of 4 units up to 24 units per month per member can be billed. If additional services are medically necessary, prior authorization would be required. You have just learned about community health workers, how to register as a CHW organization provider, and billing as a CHW provider. If you would like further information regarding CHWs, you can view resources including the CHW page on the Access website, the Fee-for-Service, or FFS, Provider Billing Manual, and the Access Medical Policy Manual, or AMPM. These resources can be found by performing a search on the Access website. Thank you for all you do in helping our members in the community.
Okay. And now we're going to go into services provided and reimbursement for CHW. So for the CHW services to be reimbursed, they have to be medically necessary and recommended by a physician or other licensed practitioner. And the CHW must work under the direction of an eligible Access registered provider. I just want to say I see a bunch of questions in the chat, so we're going to get through the presentation and then we'll wrap back around for Q&A. All right, next slide, Ruben. Okay, so these are the 3 service codes that are available for CHW reimbursement. So I'll just kind of leave those on the screen for a second. So there is a maximum 4 units per day, up to 24 units per month per member. And if additional services are medically necessary, prior authorization can be submitted for those additional services. All right. So this is a list of all of our eligible provider types that have the CHW service codes available to them. So what this means is if you have if an organization has somebody, a qualified CHW providing services at any registered access provider type that falls under these, they can be reimbursed for those CHW services without needing a separate enrollment. So if you're a CHW worker at a hospital, that hospital can be reimbursed for those CHW services. So if you're registered as a DO, physician's assistants, all of these provider types have those CHW reimbursement codes available to them. All right. So once the enrollment process is complete, so whether you're enrolled as an FQHC, a hospital, or a CHW organization, any of those registered providers can contract with an MCO. So very similar to other provider types, you can choose to be contracted with one of our managed care organizations, or you can, if you serve the fee-for-service population like our AIHP members, you can choose to remain what we call a fee-for-service provider, which has reimbursement through access. So you can go through the MCOs, you can go through access, you can go through both. It just kind of depends on the members that you serve and what health plan they're enrolled in. All right. Okay, so a point of clarification is that a separate contract is not needed to serve fee-for-service American Indian Health Plan members. By being enrolled with Access, by going through our enrollment process, you are able to provide services to our fee-for-service population. So I see a question in the chat that I can answer on this topic. It says, do we need MCO contract approval to bill? So the answer to that is, it really depends on the member you're serving. So if the member, if members that you're serving are enrolled in a managed care organization, to be able to seek reimbursement for services provided to that member, you'd have to be in contract with that managed care organization. So, it really depends on, again, it kind of depends on the population you're serving. So, again, if the members you're serving are enrolled in any of our managed care plans, you will have to have a contract with that managed care plan to be able to get reimbursement. Ruben, did you have anything to add to that? Okay, awesome. Next slide. Okay, so once a CHW organization is enrolled with Access, it's important. Oh, wow. It's important to make sure, it's important to make sure that the services provided and that you're seeking reimbursement for are for certified CHWs. That's a point of clarification, is that reimbursement can only be approved for those who have gotten the voluntary certification through ADHS. They can submit claims for the allowed codes that we saw earlier, provided by the certified CHWs. The employer must maintain accurate and current records of the CHR certification documents. So, if Access is doing any sort of review on claims, it's possible Access could request copies of certifications for CHWs, just to make sure that, we're only providing reimbursement for those certified CHW services provided. So again, CHWs who are not certified, so they don't hold that DHS voluntary certification, may not be reimbursed for CHW services through Medicaid funds. Next slide. And then, so this is our last slide. These are just different resources that we have available to answer questions about CHWs, about services, about billing codes. That FAQ is pretty robust, and we answer a lot of questions on that FAQ document. And then we have an email address here as well for any additional questions that may come across for CHW and CHW services. Okay. So, oh, looks like Ruben has the FAQs app too. Awesome. Okay, so I'm going to go over to the chat here, and I'm going to look at some of these questions and see if we can address some of them. So one of the questions is, for clarification, is the enrollment fee payment of $709 per organization or per CHW? So it's per organization. So you have your CHW organization, it's just one fee of $709. And then there was a question that says, who is a qualified referring provider? Ruben, do you want to take that one?
Yeah. So a qualified referral can get made by an eligible physician or other licensed practitioner of the healing arts acting within their scope of practice under state law. And there are a handful of providers that the physician or licensed practitioner of the healing arts needs to be affiliated with. And those are included in question 21 of Access's FAQ document. So I'm going to drop that here in the chat, and I'll point out to you all right now that it's question 21 that addresses that, which is on page 8. And some of the provider types that the physician or the practitioner needs to be affiliated with include 638 FQHCs, behavioral health outpatient clinics, rural health centers, physician osteopaths, FQHCs, hospitals, integrated clinics, physicians, physician assistants, and nurse practitioners. So that's who can make the referral for CHW services, a physician or a licensed practitioner affiliated with one of those providers. And that's question 21 in the FAQ document that I dropped in the chat.
Thanks, Ruben. Okay, so another question that I see is, it's from Sharnice. I think it says, do MCOs provide referrals to CHW organizations? I'm not sure. Ruben, do you know if MCOs provide referrals to CHWs?
I'm not aware of them doing that, like within their scope of practice. If like the MCO is like also some MCOs may also be registered as one of the provider types that I just listed out and that are on question 21. So I mean, it's possible that they could, but I don't think very many are set up to do that type of referral. If you're searching for referrals, I think it would be better to establish relationships with provider types that are on the list in question 21 of the FAQ document.
Thank you. Okay, so our next question says, does FQHC scope need to be changed since we have a PPS/APM rate? What is that process?
Yeah, I can explain a little bit about that. So the FAQ document that I dropped in the chat, question 8, covers this. So FQHCs may submit a scope change to account for CHW or CHR services as part of the PPS or APM rate calculation until the next rate rebase. So that can get submitted through the existing process. So Access has an existing process for submitting a scope change. I don't have that process at my fingertips, but if you're with an FQHC, your finance team should be aware of that. I can also follow up with Floor to provide her with the information on how to submit the scope change.
Thank you. Okay, so the next question is, do CHW organizations need to also enroll in Relias for organizational training?
I don't believe so. We have not established that as like a requirement. So Samantha, if that's not part of your provider enrollment process, I don't, it, I do not believe it to be a requirement.
Yeah, we don't have it as a condition for enrollment, so I can definitely say that. Okay. So the next question says, if we enroll folks into our program first, can we coordinate with another organization for services?
I can clarify that question. Sorry. So
No, that's okay.
what our approach, because I also commented later, our approach is a lot of the folks that we are working with in our CHW practice are folks that don't always trust medical providers. So we work with ADHS with our Health Start program, which is prenatal and postpartum care. So some of the folks that we have coming in have not had any appointments with any providers. And it's our community health workers that develop the relationship and then make sure that they get into their appointments and create a relationship with a medical provider. So in that scope, and we also do this with our homeless population as well. So we're building the trust and then getting them to a medical provider. So I guess my question is, how do we meet that medical necessity referral piece if we're doing it the opposite direction?
I think if you're enrolling folks in like a CHW program first, it's a matter of establishing a relationship with providers that your clients are frequently seeing. So at one point, I have an example of this. At one point in my career, I was managing a homeless resource center in downtown Phoenix. And our clients who we enrolled in services, like the homeless resource center services, were frequently receiving services from the healthcare for the homeless facility. So as manager of the resource center, if I was a CHW community-based organization, I would be enrolling clients into services for my organization and concurrently developing a relationship with the major healthcare providers that are serving them. So in that particular instance, it was the healthcare for the homeless facility. So I would be building that relationship and trying to help them understand what an appropriate CHW referral is. And I would probably create like a referral form, maybe a one-pager with information on CHW services, share the FAQ document with them, so that they felt comfortable in making the referral, and had like a referral form that they could use to make the referral. So that's kind of how I would handle it in a comparable situation of running a homeless resource center that hypothetically could have enrolled as a CHW community-based organization. I don't know if that's helpful at all, but
It
that's
is. So when we are completing claims on folks, do we keep the referral? Do we submit that referral with our first claim, or do we keep it on record? How does that work?
Yeah, you should keep it on record, and it should be made available in the event of an audit. So that should be kept on record, but does not need to be submitted with the claim.
Perfect. Thank you.
Okay, so thank you, Ruben. So our next question is, what about those we serve that are uninsured, but perhaps the child is enrolled? In that case, would the child's plan be billed?
So there are this is sort of a complex issue, and for the sake of community health worker services, we can't bill the child's insurance for services provided to the parent. Like that's not an option for CHW services. That may be an option for some rehabilitative services that are supporting the child. So if it was like a behavioral health service, we have at Access an opportunity to bill the child's coverage for certain services provided to the parent if they're supporting the child's care plan. That's not an option for CHW services.
Okay, thanks, Ruben. Okay, so our next question is, within our network, we have some FQHCs that are currently registered as providers. Do they need to complete any additional registration in order to bill for their CHW services or integrated CHW services? So the answer is no. If the FQHC is actively enrolled with Access, there's nothing else you need to do in order to be reimbursed for those CHW services. Those codes are included with the FQHC enrollment. All right. Are the CHW reimbursement rates listed online?
Hi, I can get that one too. They are, in the FAQ document. I'll drop the link in the chat again, because we've gotten a couple questions since then. So the FAQ document addresses this as question 9. So what you do is go to question 9 in the FAQ, and that pulls up a link to the Access Physician Fee Schedule. And you type in the code that you're looking for the rate on in that link. And so if I type in 98960, I can look up the rate and it tells me what the current rate is. So just consult question 9 in the FAQ to get the most current rate.
Samantha, Mayday has had her hand up for a while.
Yep, go ahead.
Good morning, thank you. So I am with a health plan, and I think this relates to Megan's question because we were really hoping to be able to refer a list of members to CHW organizations that are not engaged for the sole purpose of educating, especially with preventative and wellness, and getting members engaged. But and I originally read that question 21, Raven, and thought it meant it was sort of an either or, like you could either be a licensed practitioner and refer, or practicing under the auspices of being a CHW agency could could bill. But now I'm worried that we're sort of stuck in a catch-22 if we have to have the referral, the identification of medical necessity coming from a licensed practitioner with a provider type, then we can't deploy the CHWs and pay them for outreaching and getting members engaged to get in to see the provider. And does that make sense?
Yeah, and it is correct that the CHW CBOs cannot refer to their own services. Medical necessity needs to be established by a physician or a licensed practitioner of the healing arts. So I can see how that might be like a bit of a catch-22 for the sake of CHW services, because the CHWs play such a vital role in establishing that linkage to primary care.
All right, well, hopefully that will be discussed at some point, and if MCOs are able to advocate for that, for some way to allow for that, adding specific language to the AM, PM, etc., I'm happy to help, but thank you, Ruben.
Yeah, and if you have any suggestions for how we can overcome that, then we're certainly open to feedback on that. And any ideas based on your experience as an MCO, or any ideas based on what you've seen in other communities, feel free to share those through our public input box.
Okay, we will do that.
Thanks.
Okay. So I have part two to the question, and I think this was related to the question about uninsured parents, Ruben. Says part two to this question being addressed, 90% of our parents slash moms are on our discount plan. So then we wouldn't bill mom and or child on access. This is just for clarification on that.
Would you be able to provide more clarification on that question? See,
Do you want to come off mute?
Okay. I don't have an answer at this point without having greater context on it, but we'll keep that keep the door open if whoever asked that question would like to come off mute before we end this call today to provide more clarification.
Okay, if we provide a musical therapy class for kids, can we bill the child's access or when we conduct an ASQ with the child? Oh, they said, oh, you just answered my question. Okay, sorry, I missed the follow-up. Okay. The next one says, we are listed as a qualified provider type. If needed, can our clients and future clients be referred by our LCSWs and LPCs in addition to our psych nurse practitioner, or only our nurse practitioner can make those referrals? I just want to confirm that I'm thinking about it correctly. That's in reference to the referrals.
Yeah, I can share a little insight into this. So we don't get very prescriptive when it comes down to like individual provider types who are eligible to make the referral. And we use this really broad term, licensed practitioner of the healing arts, to refer to who can make the referral. And that could potentially include LCSWs or LPCs. One useful thing that we've shared with stakeholders in the community is just to consider whether or not you think that the licensing board would think that such a referral is appropriate. So that might be one thing for you to consider in determining whether an LCSW or an LPC is an appropriate referral source, is how the licensing board might look upon the provider making that particular referral. And if that's acceptable from your perspective and you think that the licensing board would be supportive of such a referral being made and it fits within your scope of practice, then we're supportive of that particular provider making the referral for CHW services.
Okay. So I think this is in reference to the discussion of like the referrals and some individuals that they work with not necessarily trusting providers or what have you. So somebody had suggested some state Medicaid programs are doing a standing order for X number of billable hours to help establish the provider relationship. So Ruben, I think that was, Vicki was just offering a recommendation as far as approaches that other Medicaid plans may have taken for that. So that's something that I think we can take back for sure. Okay, so Teresa asked, does the FAQ state the current limit per day, per member, per month, the number of codes that can be billed? And then I think there was some responses for that. Teresa, do you want to come off mute so that we can make sure we answer your question entirely?
Yeah, if we can have clarity on it says 4 units can be for the member per day. So it's 4 units. Is the 4 units, the 30 minutes, what is a unit?
Yeah, a unit's the 30-minute increment, and it can be one-on-one, or it can be in groups of 2 to 4, or
Yeah.
groups of 5 to 8.
So if we're meeting with them for an hour and a half, and for an hour, we can put down 2 codes that end in 60. So we can say that 98960 and put that down twice, and that's okay as long as it's the education or the
Yeah,
preventative services.
that's correct.
And that
Yeah,
would
so
be
you
2
can use,
units,
yes, that would be 2 units
and it's
for 1
24
hour.
per month.
4 units per day,
Right. And
24 per month.
perfect. Okay. Thank you.
You're welcome. And that's also question 8 in the FAQ document.
Perfect.
Okay. Ruben, do referrals through Unite Us count?
I don't know. I'm sorry. I'm not familiar with Unite Us.
That's the closed loop referral system.
Oh, I mean, we don't have this built into the closed loop referral system. No, I don't have enough information to say if like a referral on that through Unite Us would count. So we can look into it, but I can say that we have not like done anything special through Contexture, the closed loop referral system administrator, to build in CHW referrals or the CHW referral process. So that's not like built into Unite Us, or the Contexture system
So when
for
we,
closed
so
loop
like how, yeah, like how it works for us is that we establish the services that we provide and the medical providers can refer to us. So I'm
Mhm.
wondering if that, I mean, that would be a really nice way to track it. We would, because it would be in the system from the medical provider. And
Yeah,
then we would accept it. So just throwing that out there is something to maybe look at.
that's a great idea. That is a great idea. And I can say that we've not built out that capacity yet in the closed loop referral system, but thank you for that feedback.
All right. Well, it looks like we have just a couple minutes left. We did get to the end of our questions that are in the chat. If there's any other questions or anybody else wants to come off mute, I think, we have a couple more minutes.
This is Shernise. I guess I'm just interested to know if there's anybody on the line who already has this up and going. I'm still trying to wrap my mind around how organizations are going to get referrals from providers. I mean, are physicians actually writing orders for diabetes education? I'm trying to wrap my mind around that referral process.
I can speak on behalf of TCAA saying we do not have this set up yet. And I'm thinking like I know, and some of my team are on the call. I know that we have really good relationships with providers. So I'm guessing that we're gonna have to go out and do some education. I'm not sure how much education around to PCPs or our licensed professionals outside of CHW certification has been conducted. So I'm guessing that's going to be on us as organizations for those relationships.
Yeah. Thank
But
you.
I mean, that's why I think the United platform would be really great, because if we could do it that way, it'd be.
Okay. We have another question that says, if a CBO has reached the 24 units for a client and they need a medical necessity, do they need that certificate from an outside licensed physician or practitioner, or is there a way that the CBO can manage this internally?
I can share a little bit of information, so not too much. Access has an existing prior authorization process for a variety of services. So it would need to go through the existing prior authorization process, which I think would require the physician or licensed practitioner to sign off on additional services being medically necessary. And we can share with Floor the resources for Access's existing prior auth process. Like it just follows that that same process flow for requesting additional medically necessary services.
So once the CBO, and thank you, Ruben. Once the CBO is registered and it's actually billing, they cannot manage prior authorizations for clients, or
I do not know. I would need to, prior authorization is such a specialized area that we'd need to get more info on that from our subject matter expert. But we can take that back. And what I'm gathering the questions being is what's the prior authorization process for additional CHW services? And what's the role of the CHW CBO in the prior authorization process? Is that correct?
yes, that's correct.
Okay, cool. So I'll follow up with our subject matter expert on those questions, and I'll share it with Floor to get back to you.
Sounds good. Thank you.
Hi, can I ask more about Unite Us, Community Cares, Contexture, whatever the actual platform is called? Maybe this question doesn't make sense because I don't fully understand the platform yet. Are you saying, Ruben, that like the utilization of that for a CBO isn't built into, you know, anything official that Access has produced regarding reimbursement? But wouldn't, you know, even if that's the case, couldn't it in practice still be used for that purpose? Like there's nothing that says if there's a medical provider on this platform that is giving a referral to a CHW organization that's also part of this platform, like that would still count, right? As the required referral for the service?
I can't really answer that right now. Like I don't have enough information on the closed loop referral system requirements and configuration to be able to share that. So I
Okay, so is that more about like the technicality of how the referral is being given?
I think I mean there are a number of things. We have like a team that's focused on the closed loop referral system that has subject matter expertise in that. And we have not connected with them about CHW referrals occurring through the closed loop referral system. And that's not to say that they can't happen, but it is to say that I don't have enough information to be able to answer your question right now. We can take that back, and I can share with Floor the information that I'm able to gather about that.
Okay, and then do you know, so outside of using that, how would like technically a referral actually happen? Like old school, like I'm faxing you this referral about a patient? Okay.
Yeah, and we haven't gotten prescriptive about what the referral looks like. So I mean, it should probably be like a form or a letter or something that indicates that the service is medically necessary for this specific person who you as the CHW CBO are going to be maintaining like a medical record for and documenting your interactions with. But we're not super prescriptive about using a specific form or a particular format. But what's the key pieces of information that need to be included there are that the service is medically necessary and that the service is being provided to this specific person. Insert that person's name.
Okay, that's helpful. Thank you.
There's a hand that's up. It's Push Wellness.
Hi, good morning. I just wanted to ask for clients that we're already seeing, if those clients already have a biopsychosocial assessment as well as a treatment plan, and we do determine that they are in need of CHW services, could we then go back and make those adjustments to those biopsychosocials and add it to their treatment plan as a modification? And for new clients, would that be suffice to just have the biopsychosocial as well as the treatment plan to include that we are incorporating those CHW services for them? Is that technically considered as a referral, or will that show the medical necessity that you're looking for?
I think if the biopsychosocial was administered by a physician or a licensed practitioner of the healing arts and clearly indicated like, CHW services on it, it could potentially suffice as a referral. But I think the critical elements that would need to be documented include that it's medically necessary and that it's being provided to this particular person. I have to hop off this call. I have another meeting starting right at 10, but Flora, I'll be sure to get you follow up on the items that I've mentioned today. It's been a pleasure seeing you all. And thank you so much for giving us this opportunity to share info on CHW services.
Thank you, Ruben.
Thank you, Ruben. Thank you so much. Samantha, are you able to stay a couple more minutes in case there's another question, or do you have to hop off as well?
I have to hop off as well. But what I was going to say before I jumped off was I do see that there's a few more questions in the chat. If you guys are able to, Flora, if you're able to collect those and send those to us via email so that we can have the opportunity to follow up and be able to distribute, some of these answers. So yeah, we would love to do that.
Yeah, we have captured the questions, so we'll make sure that we send them up to you. So in case
Sounds
there's
great.
any other ones that come up, we'll also do that as well. And thank you so much, Samantha, for making the time and as always collaborating with us. And thank you everyone for participating today. I have put in the chat, our next webinar will be on creating CHW paths to sustainability. And the advisor in Indian Council in Healthcare will be presenting. Allison Lovell will be the one conducting the presentation. She has conducted a great research and put together a lot of resources and examples of how we can really continue the path and looking for that sustainability of the workforce. So hopefully you get the information, get registered, and come in 2 weeks. Allison will be presenting, and hopefully you can come and join us again. And again, thank you for being here today. As always, we are trying to make sure that we bring the information to you all. And then this is in collaboration with the Arizona Department of Health Services, with Corina Ojeda, the chronic disease manager. And we're putting together this webinars for you all. We're going to be recording, and we're going to be posting on our website and all the social media formats, so you can actually access it as well, and you can see it again. And please, do you have any questions, any ideas on how we can continue providing that support for you all to continue building that path for sustainability for our CHW workforce? Please let us know. We can collaborate, partner, and we look for other resources to bring for you all. Again, thank you. Thank you. And on behalf of the Arizona Community Health Workers Association staff and team, we hope to see you in 2 weeks. And thank you for joining us today.